Transcranial Magnetic Stimulation is a non-invasive, non-surgical treatment modality for people who have treatment-resistant depression, obsessive-compulsive disorder, OCD, agitated anxiety, interested in smoking cessation in some cases, and other. Those conditions have been approved by the FDA. Upwards of 60 to 70% of people who get TMS receive some type of positive benefit from the treatment course. Upwards of 6 to 7 out of 10 people are getting a positive benefit. We generate a magnetic field, non-radioactive, again, non-invasive, very safe. And what this ends up doing is resetting the electrical activity of the human brain back to a normal state. Hi, Dr. David Lopez back here talking with you about this new treatment option that we're offering in our practice called Transcranial Magnetic Stimulation, or TMS. So look, many people are starting to offer this really promising treatment modality across the country. So it's not like we're necessarily the only show in town, but I think that one of the things that is important to realize is that every practice has its different styles and the way they do things. So I think, when I'm talking, I'm just describing how we do things at our practice and our organization. And for the purposes of this discussion in terms of TMS, I think it's worth addressing how we would handle a patient that's interested getting this TMS therapy. Just a quick recap: transcranial magnetic stimulation is a non-invasive, non-surgical treatment modality for people who have treatment-resistant depression, obsessive-compulsive disorder, OCD, agitated anxiety, interested in smoking cessation in some cases, and other. Those conditions have been approved by the FDA to receive TMS treatment. And then there's other conditions that can be treated, so-called off-label, other conditions that include PTSD, insomnia, cognition issues like mild cognitive impairment, ADHD, impulsivity, addiction, very promising with many types of addictions in terms of reducing cravings. So TMS is really, since coming online mainstream within the past 5 years, really offering opportunities for a lot of relief for patients with mental health issues and offering symptom relief. In fact, there's been estimates that upwards of 60 to 70% of people who get TMS receive some type of positive benefit from the treatment course. And this is in contrast to people who do the traditional prescription medication route, where usually 30 to 40% of people will respond to any given psychiatric medication, such as an antidepressant or anti-anxiety agent, even an antipsychotic. So basically what that means is maybe 3 to 4 out of 10 people respond with traditional prescription medications, chemical intervention, whereas with the TMS, which is again not involving any type of medications, no surgery, non-invasive, upwards of 6 to 7 out of 10 people are getting a positive benefit. So very, very promising in terms of the efficacy of this treatment. And so to get back to what I was beginning to talk about, is if a patient came to our practice, get TMS therapy, what we would do is a full medical workup. So we do a psychiatric consultation, find out what's going on with the patient, make sure that there's various treatment options that are considered based on the results of the consult and the diagnostic impression that we would get, and we propose or we discuss with the patient what we think is going on and how we could potentially help them. And if TMS was indicated and the patient wanted to go forward with TMS, then we do a full medical workup. There's certain conditions that need to be considered. If patients on medications, we also got to consider what those medications are. There's certain kinds of things that might be non-starters. If patient has maybe metal in their head or cochlear implants, seizure disorder has to be a big consideration too. If people have a history of seizures, addictions, we don't want people. TMS can be very promising in terms of helping control addictions, but we don't want people actively using while they're going to be undergoing treatment. And so we need to collect all this information, run labs if appropriate, do a physical workup. And once we have all the pertinent information and we can make that determination that yes, patient is cleared for TMS, then we'll start the TMS therapy. And again, it would, the TMS therapy would involve the mapping. What we're going to do to further the workup is also, again, at our practice, we'll map the patient's brain, get a nice image of the brain, because the reality is, a person struggling with depression or anxiety or any kind of various mental health malady, the specific area of the brain that's not firing or functioning well, from human to human, it's essentially going to be the same, area of the brain. But also the reality is that our brains come in different shapes and sizes. My brain might not be as big as many other people's brains. And so, we got to make sure that we're measuring things out. And that's what we do, is we map out the areas of the brain precisely. So, we can pinpoint that area that is common from human to human, but maybe in a little bit different area in terms of when we start the treatment. And the treatment involves the use of a magnetic coil. So we generate magnetic fields, electromagnetic fields, but magnetic fields in particular, and we use a machine, essentially like a big giant nerve stimulator. And we generate a magnetic field, non-radioactive, again, non-invasive, very safe, to the particular area of the brain that we've mapped out and determined that this is the area that we're going to be treating for the various, for the particular mental health condition that we're trying to treat and reverse with our patient. And so we do that. We position the magnetic, the magnet, or they call it a magnetic coil in TMS parlance, treatment coil. Basically, we have mapping coils, treatment coils, and so on and so forth. And we'll position that treatment coil close to a person's scalp or cranium in a very comfortable way, and the patient is awake the whole time. And then we'll deliver the treatment. The different treatment protocols are available for different kinds of mental health conditions. They can be anywhere from just a few minutes up to 40 minutes. And again, generally a patient will be receiving the treatment. The magnetic pulses fire for a brief number of seconds, usually 3 to 5 seconds, and a bunch of pulses will be delivered. And typically a patient will feel like a tapping on their scalp when the magnetic pulses are being delivered, and then there'll be a brief hiatus, and then after that, a number of seconds pass, there'll be another burst of pulses that are delivered. And we do this repetitively, and what this ends up doing is resetting the electrical activity of the human brain back to a normal state. So if it's in a bad state because the patient's depressed or not thinking clearly, well, we can reset the brain back to its normal activity so a patient feels better, thinks more clearly, is more relaxed, sleeps better, and so on and so forth. And again, it is non-invasive, non-surgical, no chemicals involved, and you're awake during the treatment process, and it's very effective. TMS education has been delivered here with this brief discussion, and there'll certainly be more to come. I hope everyone who's listening finds this material interesting. I'm very excited about the prospects of helping a lot of people, because I've been doing this been in this field of psychiatry and mental health as a physician for almost 30 years, and just been completely positively astonished and positively impacted of the efficacy of this TMS therapy, this new treatment modality, and I just really feel strongly about sharing it with people. And so that's why I'm online today. And again, thank you for listening. I look forward to bringing more information about TMS going forward. Thanks, and have a good day. Bye-bye.